Hey guys, Johnny here from Skelian Chiropractic, a specialist physiotherapist, and today we're doing a live case study of a suspected tennis elbow. So we've got Will here, and Will's a rock climber, and he's just had about 3 months of elbow pain now. So
That's right.
How did it start?
So not an immediate onset during training, just the following morning waking up with a lot of pain and resting for a couple of weeks, but not really going away, optimistically trying to start climbing again and not working. So but as I said, it's been about 3 months now.
3 months, and you've tried some physiotherapy exercises or some stretches, so what have you been doing?
Yes, some eccentric physio and stretching as well.
So was that one, wasn't it?
Yes, that's right, and the eccentric wrist curls.
Okay.
To no real effects.
Not working for you.
Yeah.
Okay, so this is quite a common situation with tennis elbow. It often is quite resistant to exercise, so that's why we have the treatments around. But first off, we need to check it is tennis elbow, so we're going to do a bit of a scan today, make sure it is what we think it is. Where do you feel the pain?
So in the elbow, on the bone there,
okay.
And then running down the forearm when I stretch out or clench my fist.
Okay.
And only with arm extended.
So we're going to do a few tests physically. So first one is we always need to check the elbow joint is okay. So we're just going to do a simple flexion there, no problems, nothing.
No.
And we're going to go to full extension just to make sure the joint is good. No problems.
Yeah.
Good. And the other thing we look for in elbows is pronation and supination. And does that cause any pain?
That's slightly painful. Yeah.
Slightly painful. Okay. And then if we just push up into bicep curl, any pain?
That feels okay.
Okay, good. And always test the strength of pronation and supination. So we're going to go, I'm going to turn you that way and you're going to turn down.
That's okay.
No pain. And do the exact opposite. So I'm going to turn you that way.
That is slightly painful.
Slightly painful. So actually that causes some pain, and the other one was when we went into full nation. That's painful as well. Okay, fine. Excellent. So what we'll do is we will just check the tennis elbow now. So if you're in that position there, this is like the classic test. You're going to just push your wrist up and I'm going to resist you down.
Yeah, that's slightly painful.
And that's painful along there.
That's right.
Okay, and then we do the opposite as well. Often a test for golfer's elbow, but it's good to do that position.
That's okay.
And it shouldn't cause pain now. So we definitely know that you've got some the tendons in here when we stress them are causing pain. So that's a positive sign of tennis elbow. Your joint feels absolutely fine. And the other thing is you do have a little bit of biceps weakness as well. So we often find that comes together. So we might have to put that into your rehab program.
Yeah, gotcha.
So we'll go into a bit of a scan now. Okay. Right. So I'm going to start you off. So if you can scoot over to the right.
Sure.
That's it. Okay. Just relax your arms. Right then, so when we look at elbow pain, we always check the joint first. So as I come down, you'll see, if we straighten the elbow for me, you'll see your joint here, along there, the bright white line, there. And what we do is we just change the position of the probe and we look for any fluid in the joint. So when you get fluid in the elbow joint, see this recess here, you'll get clear bits of, well, it'll be a dark black fluid if there is any joint problems there. And if we see fluid in an elbow, then we get concerned that there might be something wrong with the joints. Again, this looks really good, there's no problems there at all. The other thing we look at is the biceps tendon. So the biceps tendon starts forming here, comes through, and as I come down here you'll see this white dot underneath your arteries and vessels there. As I come down, go there. And what I do then is I just flip onto the biceps tendon and you get a nice view here of this bone here, and then you get those white lines there. That is your biceps tendon there. It looks really healthy. There's no problems there at all. Okay. So that's all of those stretches are good. So we don't have to worry about your biceps. Don't have to worry about your elbow joints. So what we're going to do now is we're going to look at this tennis elbow area in a bit more detail. Okay, so as I come through here, you've got your bone here, and as I come through there, bone, and then there's the start of one of your tendons there. But then as I just sharpen up the image slightly, what we'll see is you've got a clear view of the bone there, so that's your radius, okay, and then there's part of your elbow joint there, okay. And if we rotate that around, you'll see that bone actually moving. Okay, so then relax that one down for me, and then what we do is we follow those tendons as they attach onto this area here. Now, as I come across, this is where your tendons, these white collagen fibres, attach into the bone, okay? Now with you, as we come across, you'll see that is what normal looks like. Nice bright white line and good tendons attaching in. Now when I come down, you can see there's a clear area there where it breaks down. It's quite dark, and that's what I would class as a partial tear, because you've actually pulled some of those tendons off that area. Now what we should find is that if we put on the inflammatory markers, we'll see some blood flow in the tendon that shouldn't be there, but is trying to heal the area. Okay. And that's what we need to find out. So what this helps us understand is that the reason you're probably not getting better with all the normal exercises is because you actually did suffer a small partial tear, and that isn't classic tennis elbow, so you do need to have slightly different treatments for that. There is inflammation in that tendon, but we don't really want to use a corticosteroid today, because if there is a partial tear there, we're going to just try and let it heal naturally. It's only been 3 months. Typically that might take about 6 months to fully heal, so we'll be a bit more conservative, and we'll start you off today, if you'd like to, with some shockwave therapy, which is basically sound waves that will pepper the area and stimulate recovery a bit quicker. And we usually do 1 a week for 3 weeks, and then we'll review and see how you're getting on. Okay. Right then, so we are going to demonstrate a treatment for tennis elbow using shockwave therapy. So shockwave therapy is a way of using sound waves to re-stimulate an injury which is taking quite a long time to heal. So with shockwave therapy, we're going to apply the gel over the area we're going to work with, and this is the shockwave. So we're going to put it on its lower setting today, because the elbows are very sensitive, and this is what it sounds like, so it's a little bit noisy. Okay, so if you just relax your arm there for me, and we'll start you off. So as we get up to the area where the bone injury is, it will be a little bit sore, but that's completely normal. It's almost what we need, really. Does that feel like it's on your pain?
Yeah. Right on the nose.
But then if I come down here?
Yeah, the pain reduces.
And what I'm going to do as well is just going to straighten the arm slightly, put you on a bit of rotation, so I can just get into that area. Feel that?
Yeah. Feels like it's running through the bone.
Yeah, sometimes what you can find is it actually refers to a little bit of pain down there as well. But you do say you were getting pain.
That's right, yeah, running down the floor.
Yeah. So this treatment lasts about six minutes or so. So if you think you can go a little bit higher, let me know and I'll turn it up.
Yeah, give it a go, needs be.
Well, you're doing well for the first session anyway, but we'll just turn it up slightly, by 0.1. And what you usually find as well is that it starts to desensitise.
Yeah.
So it's not as sore as it was when we started.
Yeah, yeah.
How are you finding that?
Yeah, okay. Yeah, so mild discomfort, but nothing too bad. Feels like it's working.
Yeah, well that's the thing that a lot of patients say is it does feel like it gets to the area where your problem is.
Yeah, yeah.
And in some respects that's quite nice to feel.
Yeah.
Can I go point one more? That's good. So this is about as high as we need to go on the first session. Straighten that arm slightly. Yeah. And work into the muscles slightly. And you go point one more, I reckon.
Sure.
So you're getting 1.8. So what we usually try and do in your next session is the tissue is usually not as sensitive, so we try and maybe go up from 1.8 again. So you can look forward to that.
Good interest.
Okay, so you've just got about less than a minute left, alright? I want to now just last it and put on quite a big stretch. I'm going to work on that area. Okay, 5 seconds or so left, okay. Nearly there. Done. Right, so that's your first session of shockwave therapy, and you did really well. Got to a relatively high amount of power then, so that's good. How did you find that?
Yeah, okay. Like I said, it's not a comfortable feeling, but it does feel like it's really getting to the point where the pain is, and yeah, hopefully it's stable.
And it does desensitise slightly during treatment, doesn't it?
Yeah, that's right. It starts off more painful and eases off as the treatment goes on. So
okay,
yeah, that's okay.
And what we'll do now is I'll run through the exercise to start with.
Great.
And, okay, so the exercise that I would recommend that you start with is, as we did talk about, you've got the slight partial tearing of the common tendons there, and what I find is if you just do too many of those internet exercises, which you've started, it can just make you quite sore because you're putting pressure through a tear all the time. So actually, what I usually find is when we tested you, the biceps were a little bit weak. So if we work on the biceps whilst you're recovering and healing, then it offloads the tendons there. So you don't always have to be putting loads of those exercises in. So an easy way of doing it is either with a weight, or if you want to use a band, get you one of these, and you just stand on it like that. And the key with you is to get that rotation a bit stronger. So what we're going to do is you're going to just come up and then just go into something we call supination, and then slowly back down. And these are all about control, making sure that you just squeeze right at the end, because that was when you were quite weak, and then slowly back down. And that should, obviously you might have to go a bit heavier with some weights, especially as a rock climber, but that should help you with your kind of grip, and also when you go back to activities. Okay. And normal exercise routine would be 3 sets of 8 to 3 sets of 10. If you're starting to go over 3 sets of 10, then you need to increase the weight slightly. Okay. So having seen all the exercises, the scan, and having some shockwave therapy, are you happy with the plan going forward?
Yeah, definitely. It's really good to know exactly what's been going on, and to have a plan for treating it as well. So thank you.
problem. And we see an awful lot of elbow injuries in Skelian. So if you've been suffering for over 6 weeks with your problem, then give the clinic a call. All the details will be attached to the video, and we hope to help you out on your road to recovery.